My name is Lorrie Schleg, and I'm 47. I've got two kids, an 18-year-old and a 13-year-old, and I'm a realtor. When I was first diagnosed with breast cancer, I went to see Dr. Klarefeld, my husband and I did. He sat down and started talking to us about the diagnosis and asking a few questions. And then he stopped and looked at us and asked us how we were doing and how we felt and if we had any questions. And I realized then that he was a lot more concerned about just me as a person than as just another patient. And he spent a lot of time talking to us about what the different options were and the testing that we would do. His staff was great at being able to be available to answer questions that we had after we got home, and realized that we didn't ask the right questions at that time. We were sort of in shock. And when it came time for surgery, he was great at holding my hand and talking and making sure I was comfortable with what was going on. Because I tested positive for the breast cancer gene mutation, I had to have a hysterectomy and ovarectomy, having my ovaries removed because I was at a heightened risk for ovarian cancer. And I went and saw Dr. Kristen Graham and said that I was an ideal candidate for the Vinci robotic surgical option. I knew it was less invasive, that the recovery was much better. And I had the surgery on a Friday, and the following Saturday, so 8 days later, I went on a 6-mile walk and then spent 3 hours working in the garden, and I didn't have any pain at that point. I think the people at Overlake are just very kind and concerned about the patient. If I call and I need to talk to a doctor, I'm usually get a phone call back within an hour, which I found amazing because some of these doctors are quite well known and very busy, and to be able to know that they're there and that they care about me and my concerns.